If you're a man, or someone you love is a man, in his 50s, 60s, or 70s, this might be the most important 15 minutes you spend online today. Because right now, millions of men are quietly stressing over a rumor that isn't even true. They believe that if they go too long without releasing, something dangerous is building up inside them, that their prostate is at risk, that their testosterone is crashing, that their body is somehow punishing them for not keeping up a schedule. I'm going to tell you right now, that idea is only half true, and the other half is exactly what could actually save your health. By the end of this video, you'll know the real warning signs your body sends out, the ones almost nobody talks about, because the thing people ignore is usually the thing that matters most. And for the past 16 years, I've helped thousands of older men better understand their health, their confidence, and their quality of life. Every single day in my clinic, men ask me some version of the same question. Is it dangerous to go a long time without ejaculating? Does it cause prostate cancer? Does it tank my testosterone? Some men worry because their sex drive isn't what it used to be. Some are widowed, some are single, some are dealing with erectile dysfunction, and some just aren't interested as often as they once were. And then there are men who wonder if they should force themselves to ejaculate because they've heard it protects the prostate or boosts testosterone. If any of this sounds familiar, you are not alone. But before you make any decisions based on rumors or headlines, you need to actually understand what your body is doing. If you find this kind of practical, evidence-based men's health content useful, please consider liking this video and subscribing to the channel. And let me know in the comments, what's the biggest myth you've ever heard about men's health after 60? Let's start with the biggest misunderstanding of all. A lot of people picture the body like a pressure tank, semen just building up until it becomes dangerous if it isn't released. It's an easy image to imagine. It's just not how the male body actually works. Your reproductive system behaves much more like a well-managed workshop than an overflowing container. Sperm is produced continuously in the testicles, but it doesn't sit there indefinitely waiting to be released. If it isn't ejaculated, your body naturally breaks it down and recycles many of its components. It's an efficient process that's been part of human biology all along. That means going weeks, even months, without ejaculating does not automatically create some dangerous buildup. Your body has its own way of maintaining balance without anyone forcing anything. This genuinely surprises a lot of my patients because they've spent years believing the opposite. Men come into my office worried they've somehow damaged their prostate simply because they haven't been sexually active for a while. The good news is, the answer is usually reassuring. Now, that doesn't mean ejaculation has zero connection to health. Some research, including work discussed by institutions like Harvard Medical School and the American Urological Association, suggests that men who ejaculate regularly over many years may have a slightly lower risk of certain prostate problems. Here's the important part to understand. These studies show an association, not proof that ejaculation itself is the cause. Men who are sexually active often have other healthy habits too. They may exercise more, sleep better, manage stress differently, or simply have fewer chronic illnesses. Those factors influence long-term health just as much, if not more. So if someone tells you that skipping ejaculation is directly causing disease, the evidence simply doesn't back that up. On the other hand, if ejaculation happens naturally, through sex or masturbation, and it's comfortable, safe, and aligned with your own personal values, there's generally no medical reason to avoid it. For many men, it's simply a normal part of overall well-being. Here's where the conversation gets a lot more interesting. In my experience, many older men become so fixated on how often they should ejaculate that they completely miss something far more important. They spend weeks counting days on a calendar, while their body is quietly sending them signals about blood flow, hormone balance, medication side effects, and overall cardiovascular health. Think of it this way. Imagine your car's dashboard warning light comes on, but instead of checking the engine, you spend all your time polishing the hood. The hood matters, but it isn't what keeps the car running. Your sexual health works the exact same way. Changes in ejaculation frequency are often not the actual problem. They're just a clue pointing towards something deeper. And there's one hidden issue that's so common in men over 60, most don't even realize it's happening, until it starts affecting a lot more than just their intimate life. That hidden issue is circulation, the factor almost nobody talks about. Most men only think about circulation when they hear about heart disease or high blood pressure. But healthy circulation also plays a major role in sexual function, urinary health, healing, and even your energy levels. Here's something most people don't know. The blood vessels that supply the penis are much smaller than the arteries that feed the heart. Because they're smaller, they can show signs of trouble years before heart symptoms ever show up. I've had countless patients assume a change in sexual function was simply part of getting older. Aging does bring changes, but that's not always the full story. Conditions like diabetes, high cholesterol, smoking, obesity, and uncontrolled blood pressure can gradually reduce blood flow, often without causing any obvious symptoms at first. Picture watering a garden with a hose. If the hose slowly narrows from mineral buildup, the water doesn't stop all at once. The flow just gets weaker, little by little. Your blood vessels can behave in exactly the same way. That's why paying attention to your overall vascular health is far more valuable than obsessing over a specific number of ejaculations per month. Here's the encouraging part. The same habits that protect your heart also protect your sexual function. Regular walking or light cardio. Strength training. Good for both muscle and circulation. A diet rich in vegetables and healthy fats. Managing your blood sugar. Getting enough quality sleep. These habits work together to help your body function the way it was designed to. Let's talk about testosterone. Probably the most confusing topic of all. Myth 1, avoiding ejaculation makes your testosterone climb higher and higher. Myth 2, frequent ejaculation drains your testosterone and leaves you feeling weak. Neither of these is supported by strong scientific evidence. Testosterone naturally rises and falls throughout the day. It also gradually declines with age, though the rate varies a lot from man to man. Factors that actually have a bigger impact on your hormone levels than ejaculation frequency include poor sleep, excess body fat, chronic stress, heavy alcohol use, certain medications, untreated medical conditions. If you're feeling unusually tired, losing muscle strength, noticing a major drop in sex drive, or dealing with mood changes, that's worth discussing with your healthcare provider. A simple evaluation can determine whether low testosterone or something else entirely is behind it. What I don't recommend is forcing your body onto some rigid schedule because someone online claims there's a perfect number of ejaculations per week for every man. Your body doesn't follow a one-size-fits-all calendar. Some perfectly healthy older men have an active sex life. Others are equally healthy and ejaculate far less often. Both can be completely normal, as long as they fit that individual's health, comfort, and personal circumstances. Here's something that genuinely surprises people. Stress and anxiety can sometimes cause more sexual problems than the lack of ejaculation itself. When a man becomes preoccupied with whether he's doing something wrong, his body can stay stuck in a constant state of tension. That stress can interfere with sleep, reduce desire, make erections more difficult, and even strain relationships. In other words, worrying about the myth can end up creating a very real problem. Instead of focusing on fear, I encourage my patients to focus on how they actually feel. Ask yourself, am I staying active? Am I sleeping well? Are my chronic conditions under control? Am I keeping up with regular checkups? Those questions tell you far more about your long-term health than counting days since your last ejaculation ever will. Now, here's a piece of the conversation most men never actually hear in the doctor's office, and it matters far more than ejaculation frequency ever will. The real question every older man should ask himself is, has something changed? A gradual shift in sexual function over many years can be a completely normal part of aging. But a sudden or significant change deserves real attention. If you've noticed any of the following, don't just chalk it up to getting older. Persistent erectile dysfunction, pain during ejaculation, blood in the semen, pelvic pain, difficulty urinating, a dramatic, unexplained loss of sexual desire. These can sometimes be early signs of issues involving the prostate, hormones, blood vessels, nerves, or even side effects from medications. The good news? Many of these problems are treatable or manageable, especially when caught early. The biggest mistake I see, over and over, is men staying silent out of embarrassment. Countless patients have told me they delayed bringing up a concern for months, sometimes years, only to be shocked at how many practical solutions were available the entire time. As doctors, we've heard every version of this question already. You will not shock or embarrass your healthcare provider by talking about your sexual health. So if there's one thing to take away from this video, it's this. Stop counting ejaculations and start paying attention to your body's real warning signs: circulation, hormone balance, and any sudden changes that don't feel normal. If this video was helpful, please like it, subscribe to the channel, and let me know in the comments. What's the most confusing thing you've ever heard about this topic? I'll see you in the next video, where we'll be covering. Until then, take care of yourself.